The importance of meaning making when reconciling and healing from intergenerational transmission of trauma. Trauma can be carried forward into new relationships, creating a pattern or cycle where an individual models their original attachment style or behavior from childhood, or the trauma period, and behaves in a way that elicits reactions similar to that of their children or partner. This pattern can help therapists understand the aggressor as the victim and how the process of re-victimization is interlaced through generations. Internal scripts or models can be passed on, continuing a cycle of abuse, neglect, and trauma. Women who experienced childhood trauma are at risk of exhibiting withdrawn or hostile behavior as parents. Relationship dynamics, caregiving patterns, are often recreated from one generation to the next. For example, caregivers tend to respond according to their internalized views of previous experiences. There is a link between disorganized attachment in children and unresolved trauma and loss in parents. This is likely due to caregivers struggling to adequately, and appropriately, respond to the needs of the child, due to the impact of their history of trauma. It is not the characteristics of the trauma, or the presence of trauma in childhood itself, that affect behavior. It is the mental representation or meaning regarding this experienced trauma. Parents who do not, or have not, considered how the trauma has impacted them emotionally and psychologically are more vulnerable to failures in attuning to the needs of the child. Unresolved experiences of trauma primes difficulties in regulating reactions in times of fear, stress, or helplessness, and being unaware of parents' own reactions means possibly reacting, or overreacting, in inappropriate ways when their child is also in states of fear or distress. These behaviors then may, in turn, be frightening to their child and display the possibility that they are unable to take on the role of protector. This is inadequate attunement and will need to be adjusted. To do so, the therapist aids in helping the client understand the meaning of the trauma. Therapists help explore the impact of the trauma to determine the meaning. This includes relational issues, attachment problems, and woundings. Creating meaning about a client's traumatic experience is central to the ability to heal. This may, in fact, prevent the intergenerational transmission of trauma. It is thought that when confronted with difficult events or situations beyond our control, we find ways of developing meaning out of the situations, and when we cannot change a situation, especially as children, we change ourselves. Determining the meaning attributed to the trauma, and working through any disturbing thoughts and feelings incorrectly attributed to it, demonstrates how we could become what we crave despite biological, sociological, and psychological endowments. Determining, and revising, meaning making includes focusing on narrative and personal themes. To revise the meaning attributed to the trauma, the therapist, and client, must first understand the client's system for interpreting and understanding the world, including beliefs, values, and internal representations, as well as purpose and direction towards future goals. This will show how when the client is confronted with a challenging or stressful event, they tend to appraise the situation and assign a meaning to it, based on the previously established system, private logic, etc. Making meaning out of an unresolved trauma can be seen as coming to terms with something that was essentially senseless, unpredictable, and devastating. In therapy, it is about providing support to the client trying to find meaning in a situation that has no apparent meaning. Therapists attempt to guide clients in forming their own authentic and evolving version of the story of their life, and not live trapped in the trauma. It is inappropriate to require survivors of trauma to own or take responsibility for what happened to them. What we want is for the client to shift out of a victim role into one where they feel more empowered in their present. The therapist and client work together to come to terms with the trauma and integrate it into their life story. They find a way of rewriting the client's story to create his or her meaning, to make sense of it, and to redefine their role. This helps clients build resilience and implement change after experiencing trauma.